What do you need to know about scoliosis in infants? Hi, Dr. Chris Scoobles, and I want to talk to you about infantile scoliosis. So first of all, scoliosis is defined by having a curve in your spine of a minimum of 10 degrees with rotation. Now, when we talk about infantile, I want to clarify how we classify scoliosis based on age. So an infantile scoliosis is when scoliosis is detected between the ages of 0 and 3 years old. When we detect scoliosis between 4 years and 10 years old, that's called the juvenile scoliosis. And an adolescent scoliosis is when we have a scoliosis that develops between the ages of 11 and 18. And then any scoliosis detected after skeletal maturity, which we would call an adult scoliosis. So when we look at infantile scoliosis, first of all, realize that scoliosis is only found in infants in less than 1% of the population. So how do we detect scoliosis in infants? First of all, in most cases, about 75% of the time, scoliosis is actually detected by the parents in infants and only by pediatricians in about 25% of the cases. So what should parents look for? Well, as a parent, there's several things you should look for, and a lot of it's going to be obvious body asymmetries. So if your child's a little bit older and they're starting to stand on their feet, you may look for one shoulder higher than the other. If you could have your child bend over, you may look for a rib humping. But what about if your child is not upright and they're not walking yet and they're younger? So when we look at infants in that first, from birth to that first year, a lot of times they're actually detected by parents when they're breastfeeding or when they're putting their baby down to rest or to go to bed. And a lot of times parents will report feeling like a humping on one side. Another thing you can look for when your baby is sitting, if you see like a constant or like a repetitive lean to one side, or even if they're like laying in their crib and they seem to always be curled to one side, that could be evidence of an underlying scoliosis. So it's these physical signs that we detect a lot of times more than on x-rays. So if you see any of those signs, high shoulder, if your child's bending over, you see a rib humping, or if they're smaller than that, if you notice any kind of bump or you notice a constant lean to one side, those are signs that maybe there's a scoliosis, and you definitely want to bring your child in for a more detailed evaluation, which is typically going to involve x-rays, so you can actually look and see if there is a scoliosis developing. So what causes scoliosis in infants? Well, the most common cause of scoliosis in infants and even young children is what's known as idiopathic, which basically means we don't actually know the actual cause of that. Another cause is congenital. A congenital scoliosis is when the vertebrae actually formed, deformed, or misshaped. It could be you have a wedge-shaped vertebrae, or maybe you have an extra vertebrae. It could be several vertebrae that are touching or fused together, which is known as blocked vertebrae, but it's a bone deformity that actually developed and the child was born with that. Now, another cause of scoliosis in infants is neurological scoliosis. When we look at infants, the two most common neurological scoliosis are a scoliosis that's actually caused by cerebral palsy, and another one is a scoliosis that's caused by muscular dystrophy. Now, cerebral palsy is caused when there's a problem with the brain development when it's growing as a fetus, and then muscular dystrophy is a condition where there's a weakening of the muscles, which tends to progress and get worse as the child ages. And then the fourth type of scoliosis that can cause scoliosis in infants is a syndromic scoliosis, which is where the scoliosis is secondary to some other syndrome, something like Marfan syndrome, which is typically verified on a genetic test. So what are the most appropriate treatments for infants with scoliosis? So it can be hard to do physical therapy for an infant with scoliosis, and a lot of times surgery is not really recommended. The most effective treatments for infants with scoliosis are actually casting or bracing. But here's the thing, we need to detect these early, because the earlier we do the treatment, the better the outcomes. Specifically, there was actually one study published where they looked at infants that were diagnosed with scoliosis, and they looked at 136 different infants, and they found that there was some infants that when they were treated with serial casting, their scoliosis resolved 100% to the point where they no longer had scoliosis. This was in about 75% of the cases. In the other 25% of cases, they were able to reduce the size of the scoliosis, but they never 100% eliminated the scoliosis. Now, in those that did not completely eliminate the scoliosis, in that subgroup, it was about 46 patients, they tracked these patients over time. And what they found was a lot of these patients' scoliosis started to progress and get more severe once they hit growth spurts during puberty. 15 of those end up actually having a spinal fusion. So what was the big difference between those where the spine or the scoliosis completely resolved and those that are only reduced and in many cases got worse later in life? And they found the biggest difference in those that resolved was the timing of the treatment. And specifically, when the patients received treatment before they were 2 years old, a lot of times anywhere from a year to year and a half, they had a much better outcome. And when the child didn't get treatment until after 2 years, those were the cases that had the highest percent of not a great outcome, or where the curves did not completely resolve. Another thing that we look at is something called the rib vertebral angle difference. And what we do is when you look at a spine, that's going to deform the rib cage. And you can measure the angle of the rib going to vertebrae on one side versus the other. And whenever that angle is more than 20 degrees, those infants are believed to have a less likely chance of self-resolving. If the rib vertebral angle difference is less than 20 degrees, there are some papers published that show that they have about an 80% chance of self-resolving. And if that rib vertebral angle difference is greater than 20 degrees, then those are cases that have a less likely chance of self-resolving. But when you look into those papers, what we also know, if infants have a scoliosis and they're going to self-resolve, it happens very early on in the first few months when those curves are detected. It's usually before the first year of life. When we get a little bit longer, we know that early treatment is the most important thing. Now, typically, when we're doing serial casting, and the reason they're done in a series is because the babies and infants can easily outgrow their cast. The casts are put on by using plaster of Paris. And what they do is they use general anesthesia in the infants. And then they will make a cast using plaster of Paris. The concern with this is there are studies that shown when you expose infants to general anesthesia, they're at risk of developing neurotoxicities. And there are some studies that show that exposure to infants and young children to general anesthesia can lead to neurocognitive defects or developmental problems. So it's something that we really want to avoid. What's great is in some new modern treatments like Scoli-Brace, we do not have to use serial casting. We can make custom braces using something called CAD/CAM technology, which means computer-aided design and computer-aided technology, where we can make a customized brace without having to do any kind of general anesthesia and without having to do casting. It also makes it easier to order subsequent braces as the child grows and develops. Now, I want to show you a couple different case studies. Now, this first case was an infant that was referred to a Scoli-Brace provider at 11 months. And this patient had a 44-degree scoliosis. And the patient was prescribed a custom overcorrective scoliosis brace that actually put the baby in an overcorrected position. Now, the baby was prescribed to wear this brace for 8 hours. And they did this treatment for 8 months. Now, after the initial 8 months, that curve reduced from 44 degrees down to just 14 degrees. Now, at this point, the infant was prescribed a different, softer brace that was less aggressive as a Scoli-Brace. And then at follow-up of just 2 years, the scoliosis had 100% resolved. So that was an amazing case showing a very successful treatment of a 44-degree scoliosis in an infant that completely resolved with the appropriate treatment. Now I want to talk to you about a different case where there was an infant that had the scoliosis detected by the general practitioner. The general practitioner referred the patient to an orthopedic specialist, and the orthopedic specialist recommended and gave a referral for bracing that was done at a hospital. The infant was braced and was known as a Boston brace. Now, here's something that's really important to note. When we look at bracing, one of the most important things that we need to see to determine how effective the brace is going to be is how much correction the patient receives with the brace on. Now, this patient had a 40-degree scoliosis. When an x-ray was taken with the Boston brace on, that scoliosis only reduced from 40 degrees down to 30 degrees. With only a 7-degree reduction in the curve, that tells us that that brace didn't have a very good chance, and I'll basically tell you it had zero chance of being effective in reducing the scoliosis. So the patients were not happy with the outcome of the Boston brace, so they referred brought their child into a Scoliosis clinic. Here, a overcorrective Scoliosis brace was prescribed, and when an in-brace x-ray was done, with the infant wearing the Scoli brace, the curve was 100% corrected, meaning there was no curve in the brace, demonstrating that this brace had a very high likelihood of being successful. At 24 months follow-up, with the child wearing the Scoli brace full-time or 23 hours, the curve reduced from 44 degrees down to just 14 degrees. Now, at this time, the child continues to get treatment. They're using a different kind of brace, and they're still being monitored, and they're still doing some exercises, but the curve reduced from 44 degrees down to 14, and you can see the dramatic difference in the in-brace correction in a Boston brace done at Children's Hospital compared to the significant reduction in a Scoli brace done at a Scoli Care Clinic. So to conclude, with infants and scoliosis, the earlier the treatment done, the higher the likelihood of treatment being successful. The most effective treatment is bracing. It's kind of hard to be effective doing exercises alone when you're dealing with infants. And the amount of correction done with the brace on is a high predictor of the success of the treatment. And Scoli brace has been found very effective in reducing curves using an overcorrected treatment. And in the case study, demonstrated a lot more effective than the cases that are the patients that are treated in a traditional Boston brace at a Children's Hospital. So if you're a parent, make sure to check your children. Look for any unleveling of shoulders. Look for any rib humping or any bumps sticking out. Check to see if your child constantly leans to one side. And if you do detect a scoliosis, or think there could be a scoliosis, bring your child in a specialist for an evaluation. And if there's an indicated, get the right treatment early on, because that's your best chance at a successful outcome. So if you're finding this information useful, like, follow, or subscribe, and share with others you think would benefit from this information. And if you have scoliosis or you have a child that has scoliosis, don't hesitate to reach out. Just give our office a call and ask for a free consultation to see if there's something we can do to help you.